Good morning, afternoon, evening, depending on where you are. My name is Ron Peterson, and I'm a professor at the Mayo Clinic College of Medicine. I'm a behavioral neurologist and director of the Mayo Clinic Alzheimer's Disease Research Center. I also am on the board of directors of the American Brain Foundation and belong to the American Academy of Neurology. Today we are going to be discussing COVID-19 and its impact on Alzheimer's disease. And I know that this is a popular topic right now because COVID-19 is affecting virtually all of our lives one way or another. So a common question that comes up is, does COVID-19 cause Alzheimer's disease? Will Alzheimer's disease be affected by COVID-19? And the short answer is yes and no. There's nothing in the biology of Alzheimer's disease itself, meaning the disease process, that would make a person more susceptible to COVID-19. However, if you take a look at the symptoms that are caused by Alzheimer's disease, the behaviors, the cognitive issues, individuals with Alzheimer's disease certainly may be more susceptible to COVID-19, and we'll get into that in a little greater detail later on in the discussion. First, I thought I would start with a bit of a primer so that we're all using the same language when we talk about Alzheimer's disease. This can be confusing from time to time, and we're part of the problem because we use inconsistent language. For example, is Alzheimer's disease dementia? Is dementia Alzheimer's disease? So let's start with some basic terminology. Dementia is a syndrome, meaning a collection of symptoms, usually involving memory, forgetfulness, difficulties with thinking, and it's severe enough to affect one's daily function. So if a person has cognitive difficulties affecting the daily function, they may have a dementia. But again, a dementia is a syndrome. So the question comes up then, what is causing the syndrome? And usually later in life, in individuals in their 70s and 80s, if it's been a gradual process coming on over months to years, it may very well be a degenerative disease, and statistically, Alzheimer's disease would be the most common cause of dementia in individuals in their 70s and 80s. But it could be caused by something else. For example, a person maybe has vascular disease in the brain, maybe has had a stroke or two or little strokes around the brain. That could certainly cause a dementia as well. A person uncommonly may have a brain tumor that would affect cognitive function. They could have hydrocephalus. They may have medical problems. There may be medical issues or the treatments of those medical issues that can compound the thinking and memory problem and could lead to a dementia-like condition. So dementia, again, is the syndrome, and Alzheimer's disease is one cause. Now, I mentioned degenerative diseases. Alzheimer's disease is probably the most common degenerative disease of aging, but it's not the only one. There could be other degenerative conditions, such as frontotemporal degeneration, where the frontal lobes, the temporal lobes are preferentially affected. This may manifest itself in behavioral changes for the person. The person may be experiencing almost a personality change, inappropriate behavior. Another manifestation of frontotemporal dementia could be with language. The person may have difficulty processing words, either hearing, comprehending words, producing language, and it may be a language manifestation. Another neurodegenerative disease, which is common in aging, is dementia with Lewy bodies. Now, Lewy bodies are characteristic of Parkinson's disease, and dementia with Lewy bodies is a combination of a cognitive disorder with some Parkinsonism. A person may have bradykinesia, may have increased tone, lack of coordination, usually not a tremor, but will have Parkinsonian type features coupled with behavioral changes such as delusions, hallucinations, and perhaps sleep disorders such as a REM behavior disorder. So there are multiple degenerative diseases of the brain, but up and away, in aging, Alzheimer's disease is the most frequent, the most common disorder, and that's what we'll talk about today with regard to its impact on COVID-19. So what is Alzheimer's disease then? As a degenerative disease, it is the result of the misprocessing of two proteins that get deposited in the brain. One is amyloid, and this forms the neuritic plaque. The other is the protein tau, T-A-U, and that forms the neurofibrillary tangle. You may have heard of Alzheimer's disease as being a plaque and tangle disease. That's what it means. It's amyloid and tau being misprocessed and causing destruction of nerve cells in the brain. And if those nerve cells are in the memory part of the brain, the person becomes forgetful. So, Alzheimer's disease characterized by those two proteins. Now, we won't get into it today, but there's a proposal out there in the field that the disease actually be defined by the presence of these proteins, irrespective of any clinical symptoms. So it's conceivable a person could have dementia due to Alzheimer's disease. A person could have mild cognitive impairment, which is a milder form of cognitive impairment along the spectrum to dementia, or even the person could be cognitively unimpaired, but if the person has the two proteins in the brain, amyloid and tau, one might say that the person has Alzheimer's disease. That's a discussion perhaps for another time, but does impact how we label these disorders and what it means to have Alzheimer's disease or a dementia syndrome caused by Alzheimer's disease. Now, generally, we stage the disease when people are symptomatic. The first stage is mild cognitive impairment. This means that the person usually has a memory problem, may have other cognitive domains involved, but usually a memory problem, which is beyond what we would expect for age and beyond what we would expect for that individual, representing a change for that individual. Yet their other cognitive skills and their daily function is not compromised to a significant extent. They may be functioning a bit more slowly, maybe a little less efficient, but they're still able to carry out all their daily activities. So in that sense, it does not constitute dementia. So mild cognitive impairment is sort of a pre-stage of dementia. Dementia then can be categorized into mild, moderate, and severe, depending on the degree of impairment of the individual. Again, there's no hard and fast demarcation between mild cognitive impairment and dementia or mild, moderate, severe stages of dementia, but in general, there's this categorization of severity. So when we get down to talking about COVID-19 and its impact, it may be differential depending on what stage in the process the person is at. So COVID-19 then will complicate life. It complicates life for all of us, but you can imagine somebody who has a degree of cognitive impairment. They're likely older, so they're at risk for COVID-19 by virtue of age. They may have other medical comorbidities, so they may have heart disease, they may have pulmonary problems, may have diabetes, and again, by virtue of age, some individuals might be what's called immunosenescent, meaning that their immune system is aging and may not be as effective as it was when they were younger. So their ability to fight off an infection might be compromised a bit. So all of these come together in somebody who has Alzheimer's disease. So let's take a look at a person with Alzheimer's disease then from the perspective of stage and where they are living, because that may very well impact how the disease plays out. One can imagine that if the person were living at home, they would be cared for by perhaps family members, and the family members would then be on call, so to speak, 24/7, caring for this person. Well, we'd like to think that people would be following the recommendations for living with COVID these days or avoiding COVID these days. So things like wearing a mask, frequent hand washing, keeping a social distance. that may be difficult, may be challenging to present to a person with Alzheimer's disease. Why do I have to wear this mask? It's uncomfortable, it makes me warm, and I can't understand what you're saying. I can't express myself very well with this mask on. I'm going to take it off. Similarly with the hand washing behavior. Why do I have to wash my hands? Why do I have to use this hand cleanser frequently during the day? It may help to put up little signs around the house, little reminders in the bathroom. Wash your hands carefully. Spend 20 seconds, 30 seconds washing your hands to make sure they're clean. Again, the person may not comprehend the totality of the situation, but perhaps we could make some inroads into making it a little safer for them and the individuals around them. And of course, if somebody becomes ill, so if a person with Alzheimer's disease, say, gets a fever, gets an infection, a urinary tract infection, a pneumonitis, maybe just loses some sleep and is overly fatigued, they will express this perhaps through their cognitive problems or behaviorally because they cannot verbalize what's going on, but they are affected, and it's like the cognitive function now becomes the weak link in the chain for this individual. So if they're compromised in some other fashion, their cognitive skills and behavior may deteriorate disproportionately to what you might expect. So there are certain elements of this complex situation that you can manage with people with the frequent reminders. Again, the social isolation becomes a real problem because not only keeping a physical distance, but maybe the family cannot visit. So the children do not come over, the grandchildren do not come over. And again, the person with Alzheimer's disease may not appreciate that, may say, where are they? Why aren't they coming over? What can we do about this? And this is where perhaps some elements of technology, I'm the last person to advise on technology, but this is where technology may come into play with regard to frequent phone calls at the very least, but FaceTiming perhaps using a smartphone or some kind of a video chat, having the person sit in front of an iPad and communicate with children and grandchildren visually as well as auditorily can be very helpful and comforting to the person. When we're thinking of a person who's living at home, we must also be concerned about the caregiver or caregivers, the people who are living with that person, because this is, again, a 24/7 type of responsibility, and we have to be concerned about the health and well-being of the caregiver. If the caregiver becomes ill, if the caregiver develops COVID or any other medical problem, then the whole system breaks down. So it's a good idea to have sort of a backup plan. That is, have a scenario in mind that if the caregiver becomes ill, this next person will be able to step in to handle the situation, because it can be very stressful, and you may want to do that anyway to spell the person who has the primary responsibility. And often that's a spouse, and the spouse may be older, him or herself, so we have to be very mindful of their health and well-being, and give them as much support as the person him or herself deserves. Now, another aspect of a person living at home is they may be engaged with in-home health care. That is, there may be somebody who comes into the home during the day, maybe during the week, maybe several hours a day, periodically. Of course, we need to screen that person very carefully, because we don't want that person bringing in the virus from the outside. So we have to go through the usual questioning. Have you been well? Have you had any symptoms? Have you had a fever? Have you been exposed to somebody who might be carrying the COVID virus? And make sure that these people follow all of the recommendations, like wearing a mask. To the extent you can do social distancing, but the person is there to care for the individual with Alzheimer's disease, so that may be impossible. Wearing gloves could be helpful, and certainly frequent hand washing. But here again, you can imagine a situation where the person with Alzheimer's disease, who knows the caregiver that comes in from the outside, Why is this person wearing a mask? Why is this person wearing gloves, etc.? So we'll have to deal with a gentle questioning, reminding, and saying, don't worry about it. This is, we're trying to prevent any kind of infection. We want you to remain well. But you can see how this might be a challenge for somebody who has some cognitive and comprehension problems. So that's a situation if the person is living at home, either with home-based caregivers or with individuals who come into the home from outside. What about if the person is in a nursing home facility or congregate living type of arrangement? Well, this becomes much more complicated in addition to the COVID virus itself. As you know, that here in Minnesota, I think as of this morning, there had been perhaps almost 600 deaths in Minnesota. 80% of those deaths occurred in a congregate living facility, mostly nursing home. And some of these nursing homes are really plagued by this kind of a problem. You can imagine how difficult it is to manage a facility like that. In fact, if you remember, one of the first clusters of COVID in this country took place in Seattle in a nursing home. So this has been common across the country. But if your loved one, if your family member might be in a facility, or you're going to put them in a facility for whatever reason, it might be important to actually survey the facility, find out what their policies are. What do they do if somebody tests positive for COVID? Do they segregate people? Do they have a wing of the facility where they can isolate people? What about the workers in that facility? Presuming that they are all screened daily as well, taking their temperature, following all the rules. If they have been exposed in their external world to somebody with COVID, might they quarantine themselves? Might they actually have to stay away from the facility? What if the person works at more than one facility? Might that individual actually be a vector going from one facility to another? So there are many, many complicating features in this situation. Do they quarantine people in the facility if in fact they become infected? Are there adequate PPEs in the setting for the staff, for the individuals who are working with the residents in the facility? Are they going to be adequately prepared to handle these difficult situations? The distancing there again would be a problem because again the workers are meant to care for the residents of the facility. So that is going to break down. A real problem that has arisen, of course, is that people cannot visit the residents. Many facilities will not allow visitors. I've had one patient in Florida, actually, who became quite distraught when his wife did not come there. His wife would spend virtually all day with the person, and when she could not come to the facility, he became quite agitated, quite disturbed, and actually became somewhat physically aggressive. The facility decided ultimately to let the wife come in and to be with him, and that solved the situation, at least temporarily. But you can't do that for everyone because of the risk of bringing in infection from the outside. So not having the ability to visit the person is very stressful for the resident and for the family as well. I'm sure many of us have seen these stories on television, the news programs, about celebrations that are being held outside the windows of a nursing home facility where the family gathers outside, singing, dancing, may connect with the person visually or auditorily through the window. And this is, I think, very reinforcing for everybody and is a temporary but an important intervention and solution that may help the overall situation. Here again, technology comes into play. So if the individual is in a nursing facility, and has access to maybe a smartphone or an iPad or some kind of video conferencing facility, given that the facility itself now has staff available to do this because they're pressed, they have a lot of work to do, and this is time consuming to be with each resident while the resident is doing a conversation or a video chat with family members. Nevertheless, these can be very, very important and impactful for the residents. The old techniques that we used to use with individuals who may have difficulties with, say, recent memory, but their remote memories are relatively preserved. We bring out photographs of the old days, photographs when the people were children themselves or in their younger days, may be very calming for them. And of course, music from their time, their genre of music, can be very calming to individuals in that kind of a care setting. And if you can relate to family members through that situation, that can be very helpful as well. So there are a lot of other techniques, I think, that are being used, and perhaps some of you may have some thoughts on these or some techniques that you have used, and we'd love to hear from you and share some thoughts about these different procedures so that other individuals will be able to benefit from them as well. One other feature that has to be considered in a congregate care in a nursing home facility is, what if the person gets sick? What if an emergency arises? So we all, whether the person is at home or in a care facility, if the person develops respiratory problems, difficulty breathing, develops a temperature, a fever of 100.4 or greater, you probably need to consider taking that person in. Initially, you may contact your local healthcare facility, the providers. The providers may be able to do a video visit with the person, and you may get some instructions from them, but don't hesitate to take them into the emergency room. Most medical care facilities these days have provisions for individuals who may be COVID positive, isolating them. They still have to handle all other medical problems. So if somebody gets chest pain, or somebody develops symptoms of a stroke or something like that, that's an emergency. The person needs to go to the hospital in the emergency department, and don't worry about COVID. That will be handled by the medical facility. But you should check out with the facility what their plans are in case emergencies arise. And in the hospital situation, again, all of these concerns are magnified if the person's in the hospital, no visitors, etc. But the same kinds of principles will apply. So, in short, I think that we have to use the same kinds of precautions that we're using in our everyday life. No public gatherings, keeping the distance, hand washing, personal hygiene, wearing masks if at all appropriate, are probably the best measures we can take to try to prevent developing COVID infection in ourselves as well as in our loved ones with dementia. Let me finish up here and see if there are any questions. Heather from Yakety Yak is going to be sending me some questions along the line here to try to answer, or at least put them out there for discussion as they come along. But let me digress for a minute away from Alzheimer's disease. I mentioned earlier frontotemporal degeneration and dementia with Lewy bodies, because they in and of themselves may present some unique problems. So take frontotemporal dementia. Again, I mentioned that these are people who have involvement of their frontal lobes, and as such may lose some insight into their own situation. It's not uncommon for a person who's moderately impaired with frontotemporal degeneration to be unaware of his or her problem. How are you doing? I'm fine, never better, when in fact they're really quite impaired. Well, if you now put that person in the situation of, gee, you have to wear this mask, or gee, you have to wash your hands, or you have to keep a distance, again, these individuals will not appreciate that and will have some problems with dealing with these kinds of restrictions, and so while the underlying disease process may be different, there are similar management and behavioral issues as we've had with Alzheimer's disease. And then if you get into the situation of dementia with Lewy bodies, to the extent these individuals may have Parkinsonism, there may be motor problems, so there may be difficulties with coordination, with mobility, wearing a mask, and somebody perhaps whose speech is not as intelligible as it formerly was. They may be difficult to understand if they're wearing a mask. They may have difficulty understanding you if you're wearing a mask. So you can imagine that if somebody already has cognitive issues that compromises one's ability to understand spoken language, and then you muffle the language a bit by means of a mask, you're really compounding the problem. So in fact, the cognitive difficulties may actually accelerate. And it goes into vision as well. If you're wearing a mask, your vision may be somewhat compromised, and so you can imagine that there are all kinds of additional challenges with this. But again, if we try to take the position of the impaired person, him or herself, and try to think of how we can make that person's life as qualitatively advantageous as possible, I think that hopefully with our compassion for these people, again, they don't wish to be in this problem. It's not their fault. It's the disease they have, that we may in fact try to improve their quality of life to a degree. So I want to thank you. I want to thank the American Brain Foundation for sponsoring this. I hope this discussion has been somewhat illuminating, but I don't mean to pretend I have the answers by any means, but these are important questions to address. So thanks very much for tuning in and having me visit with you.